Hi everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone, and here at the side you can see the diagrammatic representation of skull showing highlighted part, that is frontal bone. So let's start our topic with introduction. Frontal bone is a single bone, that means it is unpaired bone, that means there will be one frontal bone in every skull. It is located at the front of skull. It plays a critical role in forming the forehead, the roofs of orbit, and part of anterior cranial floor. As a part of cranial skeleton, it serves both protective and structural function, including shielding the brain's frontal lobe and shaping the upper face. Anatomical location: frontal bone is situated anteriorly of the skull, above the nasal bone, and in front of parietal bone and superior to the orbits. It articulates with several bones including parietal bone, as it articulates posteriorly with parietal bone. It articulates inferiorly with nasal bone. It articulates laterally with zygomatic bone and inferior laterally with the maxilla, and internally it articulates with sphenoid bone and ethmoid bone. So these are the 5 and 6 articulations of the frontal bone. Now let's talk about parts of frontal bone. It includes frontal schema, that is also called as vertical portion. It forms the forehead. It is smooth convex area that shapes the face and serves an attachment point for facial muscle. As you can see here in diagram, the frontal area is called as frontal schema. Next part of frontal bone is orbital portion. It is also called as horizontal portion, as you can see here in diagram. It forms roof of orbit and a small part of anterior cranial fossa, that is floor of cranial cavity. Third part of frontal bone is supraorbital margin. This is the superior rim of the eye socket, as you can see here in diagram. This is supraorbital margin. It has a supraorbital notch or foramen through which the supraorbital nerve and vessel pass through. Next part of frontal bone is glabella, that is smooth area located between the eyebrows just above the nose and between the two superciliary arches. Next part is superciliary arches. These are curved elevation above the orbits where the eyebrows sit. They are more prominent in males. Next part of frontal bone is frontal sinuses that are located within the frontal bone. There are two air-filled cavities above the orbit. They are part of paranasal sinus system and open into the nasal cavity. Development and ossification of frontal bone. Frontal bone develops from two ossification centers, one in each half. At birth, it is divided by the metopic suture, which is usually fuses by the age of 6 to 8 years. In some adults, this suture persists as a persistent metopic suture. Ossification begins in the fetal stage through intramembranous ossification, where bone develops directly from the mesenchyme without a cartilage model. Articulation of frontal bone with other bones. Frontal bone connects with 12 bones in total. They include two parietal bones, two nasal bone. It also articulates with the two maxilla, articulates with two lacrimal bone, two zygomatic bone, one ethmoid bone, and one sphenoid bone. These articulations form various parts of face, skull, and orbits. These articulations are important for the exam point of view, so you need to remember them. Now let's talk about functions of frontal bone. First function is protection, as they protect the frontal lobes of brain, which are responsible for voluntary movement, decision making, and speech. Second function is structural support, as they form the forehead, upper face, and roof of the eye socket. It also provides attachment point for facial and scalp muscle. Third function is housing frontal sinuses, as they reduce weight of skull, help to resonate the air, and assist in warming and humidifying air during respiration. Fourth function is passage for neurovascular structures, as the supraorbital foramen or notch is there that allow passage of supraorbital nerve and arteries supplying the forehead and scalp. Now let's talk about clinical significance of frontal bone. First is frontal sinusitis. Inflammation or infection of the frontal sinuses can cause headache, facial pressure, and nasal congestion. It is commonly associated with respiratory infection. Second significance is skull fracture, as trauma to the forehead can result in frontal bone fracture, especially in the orbital portion. These injuries may affect the brain or eye structure and often require imaging for diagnosis. Third significance is surgical access. Frontal bone may be accessed during neurosurgery or reconstructive procedures. Care is taken to avoid damaging the frontal sinuses and surrounding nerves. Now let's talk about conclusion of this lecture video. Frontal bone is essential cranial bone that not only contributes to the aesthetic appearance of the face but also plays a crucial role in protecting the brain, supporting the orbits, and facilitating sinus drainage. A thorough understanding of its anatomy is fundamental in fields like anatomy, medicine, dentistry, and surgery. As a gateway to several critical neurovascular structures and key components of the skull, frontal bones stand as a central element of craniofacial anatomy. And this was all about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.